I'm a professor of neurology and I've been teaching epileptology and neurology both in adult and children for the last 41 years. All, of course, it has been a very, very important day today. Even after four decades of academics or teaching neurology, I have been learning, and I've learned today, and especially a session by Professor Raza has been absolutely captivating. I know Professor Raza for a long time, and he has always been promoting very elaborate sessions. Now, this is very, very important. I mean, what is important is that not only are we talking about migraine, but we are talking of a very important thing which is very common in Pakistan now, and is becoming commoner under these adverse circumstances, not only for domestic reasons, for even national reasons. So it's very, very important. So Professor Raza's session has been excellent. It was captivating. He has delivered a session. I may have stopped him there, but there was so much to talk about. I mean, there's so much to talk about when we come to depression. The other thing is, now we come to the vascular headache called migraine. Migraine, as we all know, most of you would know what I'm talking about. This is not a teaching session now. It's very, very important that these sessions are just to discuss. I may have been treating migraine for 40 years, but doesn't mean that I know more than you. The recent updates on migraine have created such an impulse on treatment of abortive treatment of migraine that we are still learning. So today what we are talking about is, I'm going to make it short because we are already running into a delay. So we are going to talk about triptan. Now, triptan is very important. Why? I've been doing triptan for the last so many years, since the very advent of triptans. But these recent studies have shown that the three important triptans, for example, zolmitriptan and somatriptan, are a little less effective than the new triptan. You see, if you look at the international studies, the efficacy of triptan is 78%, the others are 74%, and the somatriptan is 72%. So it does not mean the other triptans are not working. This is a wee bit better. The other thing is that the onset of treatment, the onset of efficacy is just from 30 to 60 minutes to 2 hours. And this is slightly faster. So it's very important, where do we go in? I can keep on talking about migraine because incidentally, Raza Saab, I did the first ever population-based study on headache in Pakistan. It's all over PubMed. So we did the first ever population-based study on headaches in Pakistan 8 years ago. So this is extremely important that we understand that migraine. Dr. Saab ne, Ubaid Saab ne, he went to the basics of migraine, which was very important. And we all, as youngsters, we must all learn that migraine pathophysiology is now changing with the passage of time. And when triptans have come into play, they are playing an enormous role. Where we're talking of quality of life, yaar. Hum baat kar rahe hain quality of life ki. Life means every moment of your life is important, yaar. We are not getting any younger. We are losing time in life. We have to address the issue of time, yaar. And this is exactly where the abortive treatment of migraine comes in. We are not even talking of the preventive treatment. We're talking abortive treatment. A patient, a doctor, a consultant, an executive, he goes into a meeting and he's got headache. We need treatment right there at that very moment. And this is where the abortive treatment of migraine works, yaar. So this is why we are standing here today talking of how to break the continuity of headaches, how to abort these headaches, yaar. If you don't abort these headaches, this guy, gentleman who is chairing a session, a huge session, will not be able to deliver it. Because he is being dubbed by this migraine attack. Migraines can be very, very excruciating. They can be very disabling. So migraine is a disabling headache. जब हम बात करते हैं टेंशन टाइप हेडेक की, टेंशन टाइप हेडेक इज नॉट अ डिसेबलिंग हेडेक यार. A lady comes to me and says that 1 महीने से मुझे सर में दर्द है. आप करती हैं जी, मैं घर का खाना पकाती हूँ, पकाती रहती हूँ, दर्द भी होता है, मैं खाना भी पकाती हूँ, बट in an attack of vascular headaches like migraine, you cannot work because it is disabling. It disables you. It does not allow you to work. So this is important, and that is exactly why we are talking of triptan, and we are talking of this drug, because this aborts, this cures the acute attack of a migraine, which is so important in certain adverse situations and circumstances. तो ये बहुत इंपॉर्टेंट है कि हम कैसे अबॉर्ट करेंगे भाई. बहुत सी चीज़ें हैं, देयर आर सो मेनी पैराफर्नालियाज अबाउट हाउ ट्रीटमेंट्स आर कंसर्न, बट दे आर ऑल प्रिवेंटिव. फूड इनटेक, थकन से बढ़ जाता है, खाने की कमी से बढ़ जाता है, सीप की कमी से बढ़ जाता है, धूप से बढ़ जाता है. ऑल दीज आर रियली ट्रिगरिंग फैक्टर. बट व्हेन वन इज ऑलरेडी ट्रिगर्ड एंड द हेडेक इज एट फुल ब्लूम, दैट्स एग्जैक्टली व्हेन the role of these acute medicines come into play, like for all the triptans. और दूसरी बात बड़ा इंपॉर्टेंट है, आपको बताना पड़ेगा, जैसे रजा साहब ने कहा कि पेशेंट को बताना पड़ेगा, कोई ऐसी दुनिया में दवाई नहीं है विच डज नॉट हैव अ साइड इफेक्ट. सर जब दवाई काम करेगी तो थोड़ी बहुत गड़बड़ तो करेगी वो. सो दिस हैज़ टू बी कन्वेड टू द पेशेंट इन द निक ऑफ टाइम कि भाई आई एम गिविंग यू मेडिकेशंस, लेकिन ये सोचें कि ये दवाई के बुरे असरात भी हो सकते हैं और ये कोई 2 घंटे में काम नहीं करेगी. इट इज गोइंग टू टेक अ कोर्स ऑफ टाइम टू इम्प्रूव एंड टू बी इफेक्टिव. सो दिस इज वेरी इंपॉर्टेंट. So here we will not take more of your important time. There is so much else to be done today. So if you have any questions from any speakers, this house is now open. Thank you.